So across the world, the impact of the Omicron variant is being seen, with the UK reporting record cases, France reporting 1 lakh daily cases for the first time, and high number of cases being reported in the United States as well, which have led to calls for vaccine boosters and restrictions. Now, there's also been talk of the Omicron variant being milder than the Delta variant. However, some doctors say this is a dangerous trap to fall into. The fact that Omicron can evade vaccine immunity is a huge worry, and the fact that it's more infectious is a matter of concern. We're now joined by Dr Deepti Gurdasani, who is a lecturer and epidemiologist from London. Thank you so much for joining us on the program. Now, you've spoken out about how overall Omicron causes severe disease and how we shouldn't get complacent. If you could explain that.
So I think it's important to understand that Delta and Omicron are infecting different groups of people. So Omicron, the huge part of the advantage that it has is it's able to penetrate through some of the vaccine immunity and some of the previous immunity that we have to Delta. So it's able to infect people that Delta wasn't able to infect. Now, because these people have previous immunity, obviously they have some level of protection against things like hospitalization. So if you compare overall the people who are infected with Omicron to overall the people who are infected with Delta, then it might look like it's less severe. But the fact is that it's infecting people who were not previously at risk from Delta. So for example, if you have 2 doses of vaccination, you have much less protection against infection with Omicron, but you were much more protected against Delta. So it's infecting people who wouldn't have been infected before. And even if they have some protection against hospitalization, which they do, their overall risk is still higher than it was before with Delta. And I think that's what we have to really look at, because whether you get hospitalized depends on 2 things. One, what is the chance of you getting infected? And if you get infected, what is your chance of getting hospitalized? And your protection against Omicron, against infection, is now much lower because it's able to escape vaccines much better. So that means overall your risk of hospitalization is actually higher. But the reason people think that it looks milder is because they're making sort of unfair comparisons between all the people infected with Delta and all the people infected with Omicron. And you're much more likely to be infected with Omicron, if you have previously been vaccinated or infected. You still have good protection against severe disease, but it's the sheer rate of infection that puts people at risk, if that makes sense.
All right. So the rate of infection is what's concerning. Also, the immunity escape. So, Doctor, what is the situation now in the UK? And we've seen that the surge in cases in South Africa seems to have receded as quickly as it went up.
Yes, so I mean, certainly the Gauteng and other provinces look like the infection has peaked. And there might be several reasons for that. One of the reasons might be that schools closed. So schools closed, I believe, first to second week of December. In Gauteng, there was a holiday started, which is where a lot of people leave. So there may have been behavioral changes. The second thing that I think a lot of scientists are wondering about is whether the time from somebody getting infected to be able to infect somebody else is smaller for Omicron. And if that is the case, and what you tend to see is very, very, very quick rise in infection, but you can also see very, very quick falls in infection. But that doesn't mean that a lot of people won't get infected in that process, and that a lot of that will translate into hospitalizations. So Gauteng did see a lot of hospitalizations. It was less than expected from the number of cases, which makes sense when you think of who Omicron is infecting. It's infecting people who likely have past infection or vaccination. So their outcome will be better overall, but it can still burden health systems a lot because of the number of people infected. So in London, for example, now when we're feeling the impact of the variant, we're seeing hospitalizations double each week, which is quite similar to what was seen in Gauteng right at the beginning. But it is possible that it will peak earlier. Part of that might be behavior change. Part of that might be the variant being able to infect people faster and reach the peak and then come down again. But I think we have to wait and see. But in the meantime, health systems are being burdened quite a lot. So it's not that this is not a serious crisis. It is.
All right, and that is the worry, healthcare systems are being burdened. So what do we now know about the virus? There's some reports also suggesting that it doesn't cause that, dip in oxygen like we saw during the Delta wave.
I mean, I think there's very, very, very early evidence that Omicron might be potentially associated with a shorter duration of hospitalization, but we don't really know that exactly yet. Again, part of that might be that it is infecting people who were previously protected against infection and now are getting infected but have some protection against severe disease. So it might again be down to the population that's getting infected. But I think we have to remember these are people who wouldn't have been infected by Delta. So overall, their risk has increased, even though for the number of cases that we see, the severity might appear lower.
All right. And now in India, we have finally announced vaccines for the age group of 15 to 18 years and also boosters for frontline and healthcare workers, also elderly with comorbidities. And we're holding that, this will help our population when that surge from Omicron comes.
So I think boosting is vitally important, but I think given that it's been started now, it's not going to be a very, very quick response. And this is a variant that everywhere it's been seeded has spread very, very rapidly. And by very, very rapidly, I mean over about 2 weeks. So my advice would be, one, try and slow down the variant as much as you can by having sort of restrictions or quarantines and pre-screening of travelers. But also take other measures to reduce community transmission. Boosting by itself, because it takes time, will not be sufficient. So what I would say is masks, not just sort of cotton and surgical masks, but, high-grade masks, which I think the government should provide, FFP2, FFP3 masks. Again, focus on ventilation. So try and limit socializing indoors. If you do meet people indoors, keep your windows and doors open, maintain that distance. All of those things together. And if you have symptoms, even if you have a scratchy throat or sneezing or runny nose, all of these are symptoms of Omicron. You don't have to have a fever or a cough. Do get tested because that helps catch infection early and prevents other people getting infected.
All right, and don't go out anywhere if you do feel a scratchy throat. And finally, doctor, many of the states right now have announced night curfews. Delhi is under night curfew now. There's been some amount of criticism and pushback on this. What is your view on night curfews?
I mean, my view on curfews is mixed. I mean, to be frank, during the Delta wave, curfews were completely inadequate. I mean, in most countries, we didn't see curfews turn around the spread of the variant. So I don't think they're the most effective measure by government. I think there are many, many other measures that could be taken. And I think the government really needs to stress this sort of multi-layered approach and make the public aware that this pandemic isn't over and this variant spreading can lead to serious crises and that people need to take that action, support them in taking that action, support them financially where they need support for isolation. I don't think curfews by themselves would be adequate to stem the spread of the variant, given what we've seen in other countries.
All right, Dr. Deepti, thank you so much for joining us on the program this morning.